The National Health Portfolio Committee has expressed concern over the state of the Department of Health in KwaZulu-Natal. The committee will, in the next 4 days, conduct oversight visits to several healthcare facilities in the province. There has been ongoing concerns regarding poor service and the shortage of medication in public health facilities in the province. Here's SABC News reporter Nonhlakanipho Magwaza.
We're just outside Kamalake Community Centre here in the Ugu district, where the National Health Portfolio Committee is doing an oversight visit. And of course, we all know that here in KZN, there's been a number of issues raised by the communities, and they've been out there in the media and social media. One of those is the shortage of medicine, the poor quality of health services that the community is receiving in health facilities around the province. However, we do have the chairperson of the Health Portfolio Committee with me, Dr. Dhlomo, who will be highlighting or telling us more about their oversight visits and the reason for their visits here in KwaZulu-Natal. Dr. Dhlomo, we did attend the brief session that you had with the Provincial Health MEC and the department, and they've raised some concerns. Some of them are the budget cuts and stuff like that. But just tell us the overall visit, the main reason for the visit here in KwaZulu-Natal.
Thank you very much. As you know, that as members of parliament, we actually approve budgets that gets used by departments, and they actually get to be using them against a particular plan. So we're here not to really do anything unusual, is to do an oversight on a plan that they propose to us that they would like to use. Now, we have been to Eastern Cape, Northwest. We are here now in the KwaZulu-Natal, visiting not all hospitals but some. We're delighted that MEC could spend the whole morning with us, explaining and leading a team that was explaining some of the issues that were challenging and are still remaining challenges. Here at Kamalake, already I'm happy that some of the members of the society who wrote to us regarding what they think is challenging with attitude of staff, shortage of medicines. We are going to get a hands-on responses today. We also will be visiting other facilities like Pixlika, Isaseme tomorrow, and also Prince Mshini hospitals. There's nothing, we can't leave KwaZulu-Natal having not visited forensic pathology services. We go to Parkreen and go to Phoenix, because there's always been over 1,000 of unclaimed bodies remain in those mortuaries. So we hear that the department has done relatively well. They have half that number reduced. So we are looking forward to really seeing that and getting that report. So it's nothing more than just do an oversight on the budget allocated for them to do this, that, and the other. However, there is this issue, which is a big challenge. You have a population increase, but you don't improve and increase the number of staff who are working there. Budgetary constraints, austerity measures. So those are some of the things that we need to actually check and work on it. But one of the last issues that they raised, which is a very challenging matter, is an issue of ambulances. We want to request our members of society, if you call for an ambulance, please make sure that it is a real call. Number two, hijacking of ambulances, our staff being threatened and victimized, they're not going to actually be something that is recorded well. So we want to appeal to our society members to look after our citizens, look after our nurses and doctors. They come to give us a service. Can't really, in return, kill them or maim them.
Now, Dr. Dhlomo, going back to the issue of shortages of medicine, it's not only Kamalake. We've visited a couple of hospitals around the province. They've also complained of going to hospital on their dates but not getting their medicine. And of course, since you're going to Prince Mshini, there's been a number of issues that were raised from Prince Mshini. Now, on the side of shortages of medicine, probably it's nationwide thing. What did you find to be the problem? Is it because of lack of budgets to buy these medicines, or is it because the hospital staff is buying more medicine compared to others?
We did not create this. In the department that says that we have what we call 18 non-negotiables. They created what is called non-negotiables. Among those is availability of medicines. Now, it means they can compromise this, that, and the other, but the package of 18, they must really be able to deliver them. So I was saying to the MEC that you have a stock availability of up to 80%. It means 20% you don't have. So what do you do to those patients or to those members of the society who otherwise we're supposed to get, and there are 20% of them? So we should be able to say, create a plan, make sure, but with this budgetary concern, it means they must let go of other programs, or they must do without other programs, so that they could really make sure every citizen gets into the hospital, clinic, get medication that they so deserve. So it's a matter of them. Some of the things that they were not able to answer us, we said, look, give you days. We are here the whole week long. Let us come again on Friday and finish off our discussions and make sure we can actually be able to. Well, sometimes we need to assist them. As members of parliament, we approve and talk to ministers, talk to the Minister of Finance, who also, by the way, is very supportive in acknowledging that there are these things called accruals. You see, as we are going to get a budget approved, most government departments, health included here, they are going to take a big slice of what is allocated for 2025, 2026 and cushion the accruals that they already experienced. So that issue is a vicious cycle. Someday, somehow, we need to actually stop that.